On October 4th, thanks to an educational grant from Pfizer, Men's Health Network, along with the American Cancer Society and the American Lung Association, hosted a smoking policy summit in Washington State. Washington State lawmakers, officials like Senator Karen Kaiser and former Governor Gary Locke gave an update on the latest anti-smoking policy to health professionals, activists, community leaders, and lawmakers. Dr. Brad Felker presented the benefits of smoking cessation, while various speakers discussed the program's reimbursement challenges for the state. The summit covered a wide range of issues, including the impact of smoking on Washington, the latest state policy, and reimbursement challenges, which offered a call to action and coalition building. Following the event, Men's Health Network spoke to Gary Locke, former governor of Washington State. What more could be done in the state of Washington to assist people to stop smoking?
Well, we've done a remarkable job in the state of Washington over the last 6-7 years in reducing the rate of smoking among adults and teens and pregnant women. But there's so much more that needs to be done. And various national panels appointed by the president, as well as cancer associations, have come out calling for the use of all these tools, including or smoking cessation programs, medication, that should be covered by both private insurance as well as Medicaid, Medicare programs. After all, smoking is causing thousands and thousands of dollars to every person in terms of societal health care costs, billions and billions of dollars just in the state of Washington alone to the government and the private sector. So if we're really serious about trying to reduce the incidence or rate of smoking among adults and teens and women who are pregnant, then we ought to be providing that coverage of smoking cessation programs, including drugs, under Medicaid, Medicare, and private health insurance plans.
Can you tell us a little bit more about what we are doing here today at the symposium?
Today's forum is an opportunity to learn more about what works, as well as coming up with strategies on how to be more effective in reducing the rate of smoking in the state of Washington. Over the last 6-7 years, we've been able to reduce the smoking among teens by almost 50%, among adults by over 20%. We've actually exceeded the targets that we set back in the year 2000 when we started the anti-smoking campaign. And because of the incredible success in the state of Washington, we're now setting higher goals, loftier goals, and we can do it. But to be successful, we need to involve people from the community, especially people of color and low-income people, because they're the ones who are still smoking more than the general population. And we're seeing an upsurge of smoking among teens, 10th graders. Although we've been effective, we cannot rest on our laurels. We cannot use the same strategies. We've got to be even stronger and bolder.
Can you tell us the importance of this event?
Well, I'm just so pleased that so many organizations are convening this summit today. The Men's Health Network, Pfizer, the American Lung Association, the Cancer Association. We need that collaborative effort to find out what's working, what other strategies we need, and to hear from affected communities on what messages will really work. Our success in the state of Washington in reducing teen smoking by more than 50% came about by talking to teens, asking them what messages will really work for you. What do kids respond to? Is it television? Is it radio? Is it print? And what types of themes we should be using. If we want to go to the next level in the state of Washington, forums like this, sponsored by the Men's Health Network and by Pfizer, with a grant from Pfizer, will be so important in helping us achieve these higher targets that we've set for the state of Washington.
How has the Men's Health Network and other partners enabled you to better coordinate and advocate for smoking cessation in Washington State?
Well, when we first started the program 6-7 years ago, Washington was the 20th best in America in terms of the rate of smoking. And now we're the 5th best in the country in terms of the smaller number of people, fewer number of people who smoke. If we want to be better yet, to be the best in the country, if we truly want to eradicate and stop smoking, because we still have almost a 750,000 people smoking in the state of Washington, we're going to need the advice of stakeholders, finding out how we can hone our strategy and our messages even more. The Men's Health Network is so important in that, in terms of finding out, using their network of people, of their organizational skills, their newsletters. We've got to get the word out. And we've got to find out from all these groups all across the state, all stakeholders, every part of the state, all income levels, representatives of the different ethnic groups, using the public and the private sector to figure out a better strategy to get us to the point where we do not have people smoking anymore.
How important is it to bring people from diverse backgrounds together to discuss smoking cessation?
We need to bring people of diverse backgrounds, especially people of color, different ethnic groups, and people of lower income levels into the discussion, because it's those groups that actually have a higher rate of smoking than the general population. Yes, we can be very proud of the reduction of smoking in our state, but we still have a higher rate of smoking among lower income, people on Medicaid, as well as the ethnic populations.
What is important about this event?
Well, I'm just so impressed that there's a lot of new drugs available, new therapies available, and what really works is both that counseling and the drugs, and that we have to be determined. We have to provide that network of support and encouragement, and that, I mean, quitting smoking is tough. Just trying to do it on your own, only 7–8% of people who try to smoke will be successful after a year. But if you combine it with other therapies, different types of drugs, counseling programs, success rate goes up, and we as a society will save billions and billions of dollars.